Good morning, everyone. Welcome to the August 5th, 2021 Public Health Media Briefing. As usual, we will allow for time after the public health update for media to ask questions. Please raise your hand in the box. I will call on you one question at a time. If you have additional questions, please get back in the queue. With that, I will hand it over to Dr. Kasiriye for an update.
Good morning, everyone, and thank you for joining us again. So with the numbers, and these are numbers from yesterday, we are at 117,831 cases of COVID-19 reported to the county, 1,790 deaths. We're averaging between 300 and 400 cases, new cases on a daily basis. And the case rate from yesterday was 25.6 per 100,000. We continue to monitor as we are still seeing an uptick and an upward trend in the numbers. Right now, we are working on being able to implement the new state health officer order, which required healthcare settings to set up a system for verification of vaccination and for setting up testing for those that are unvaccinated. So we are working with internally in the county with the systems that pertain to that, and then also assisting other entities within the county that also fall under this health officer order. So with that, I will turn it over to Rachel.
Hi, good morning. I have some data that I can share with you. I know the last few weeks that we've met, many of you have had questions as to whether we're seeing an increase in vaccinations, and I think we shared that anecdotally we've been hearing from our partners the same thing, but now we do have some data that we can share. And I'll add that we are also seeing an increase in vaccine being ordered by providers. So I think that confirms what we're seeing. But here's some data, and this is related to the demand for initial doses. So not the full series, but the initial dose. And this is data by week. So there was a 40.8% increase in initial doses administered during the week of July 18th through the 24th, when you compare that to the week of July 4th through the 10th. And so when you look at actual numbers, that's 9,596 doses administered during the week of July 18th through the 24th versus the 6,798 doses administered during the week of July 4th through the 10th. So definitely encouraging to see that. We need to see more. I think that's our message. We're encouraged to see those numbers going up, but really to decrease the transmission of this virus, and especially with Delta in the community, the possibility that other variants could loom. We're once again just urging people, please, if you're on the fence, if you haven't had time or been able to make time, now is the time to get vaccinated. And we would just ask that you don't delay. I also have data related to vaccinated versus unvaccinated cases for July. So there were 1,441 fully vaccinated cases out of a total of 8,905 cases. So that's a 16%. 316 of them were actually symptomatic breakthrough cases. So that's 3.5%. 9 out of 98 people that were hospitalized due to COVID-19 were fully vaccinated, and that represents 9.2%. And 2 out of the 17 deaths that were attributed to COVID-19 were fully vaccinated, and that's 11.8%. 53% of fully vaccinated cases were symptomatic compared to 83% of non-fully vaccinated cases. But I think the number that we really want to look at is that looking at the entire course of time that we've been vaccinated, out of 760,293 fully vaccinated individuals to date, only 511 have later become breakthrough cases. That's less than 1%. So, that's the encouraging number. And again, the reason that we're really want to urge people again to get vaccinated, not just for their own protection, but for our community as well.
Okay, I will now open it up for questions. If you have a question, please raise your hand. Michael, go ahead.
Hi, yeah, this is Mike McGough, SACB. Last week after the issuing the mask mandate, Dr. Castillo said the county wasn't considering any tighter restrictions like capacity limits. So I just wanted to double check to see if that's still the case. And if so, are there any particular metrics? I mean, is it case rates or is it hospitalizations that we would potentially look at if things started to get worse at having to do anything beyond the mask mandate?
We're not considering any additional restrictions at this time, and we do continue to work with the state in terms of if there are any additional metrics that we need to look at. We have been following the hospitalizations, and the numbers are going up. But in talking with the hospital administrators, they have told us that they are still able, they still have the capacity to handle the cases that are coming in. So continuing to monitor that.
Any additional questions? Alex, go ahead.
Yeah, I wanted to ask, I know, Rachel, you had mentioned the word is really trying to get those stragglers who are on the fence to get vaccinated. I guess I'm wondering, what are the common reasons that public health staffers are hearing from people who are currently getting the vaccine as to why they took so long? And then I guess sort of related is, I'm wondering, with this big push from the Biden administration to get the vaccines fully FDA approved, do you suspect that might have any impact on vaccine rates as well in Sacramento County? Thanks.
Sure. So I do think, seeing the news of what's going on, and not just in California, but across the country and across the globe, with Delta variant, and then the possibility that there may be other variants, and people really understanding that stopping the spread, stopping transmission is how we get ahead of this. I think that is a factor, definitely playing a factor. I think we've had many people say that they that is what it's taking to convince them. And I think we've also had some compelling stories in the media to see people who've not gotten vaccinated, and then later it has not gone well for them, whether they suffered a hospitalization or even a death. So I think those stories, they help. They're hard to hear, but they are helpful. We do know that there are a lot of people that I think as many as 40% of unvaccinated people who say that they're waiting for FDA approval will do it once it's approved. So I hope that brings a big number in. We think that that's coming soon. I think that if you're waiting for that, I would still reevaluate. We have lots of data to show that those who've been vaccinated are healthy and safe, and so I would encourage people not to wait. I think delaying even a day could be risky. So, but I do hope that once we get that full FDA approval, that we'll see another big increase.
Michael, go ahead.
Yeah, Mike again. I think it was 3 or 4 weeks ago. I think Dr. Castillo said we weren't seeing outbreaks linked to, congregate settings like nursing homes where there's high vaccination rates. So I wanted to check if that was still the case, and are there any settings in which we are seeing what you describe as outbreaks? Are we seeing that in workplaces or linked to gatherings, that sort of thing?
I'll start off, and then I'll turn it over to Jamie for additional information. So with the congregate settings, we have had a few reports of outbreaks, but they have tended to be small and easily contained. And again, we attribute that to the high vaccination rate, especially of the residents. And most of the cases that we're getting are among unvaccinated employees in these long-term care facilities. And then for other outbreaks, Jamie, do you want to add anything?
I don't think so. I think we're, worried about the potential for outbreaks within schools once, there are more schools opening. So that's something that our teams are monitoring really carefully. And then I don't have the exact outbreak data in front of me, I can follow up and provide Sam with some data following the call to send out on kind of where specifically we're seeing outbreaks if you want exact metrics. But I would say that, you know, we have a team of nurses who do education, they do in person. When there's an outbreak, they'll reach out and investigate the cases. They'll do the tracing. They'll put people in isolation or quarantine as needed. They'll provide, you know, infection control practices and support. And so they're really adept at dealing with those localized outbreaks within congregate settings.
Okay, seeing no additional questions, I will conclude the media briefing for today. This recording will be sent out to you. A link to download it will be sent out to you this afternoon, and a link to YouTube so you can view the video will be put on the COVID website. Thank you all.